Well, I had an anterior approach left total hip procedure.
And the difference is with the anterior approach, I use a 6-inch incision or less. I come through the front of the hip. I don't have to cut through any muscle. I just move the muscles out of the way, and then I do all my work through this small window. I don't have to destabilize the hip like you do with a posterior approach, and so the dislocation rate for an anterior approach hip replacement is extremely low. Dislocation means that the ball pops out of the socket, and some people are familiar with different restrictions, like they can't cross their legs a certain way or can't lay in bed a certain way. And really none of that applies with anterior approach because it's just a more stable construct. So that's what we did for Pam Kershner. That's what I do for all my total hip replacement patients. I think that's a game changer. If I needed to have my hip replaced, I would definitely want it done that way.
It's just been amazing. I wouldn't go anywhere else. There's no reason to. Well, I'm glad you asked, because it's like from the get-go, you know, there's a whole process that you're going to go through. And, you know, I came in with pain, but, you know, when I left, I have mobility, I have no post-op infection from any reason, you know, or no complications. So that team all has their little part that plays that. I felt very much embraced, you know, and safe. And when I mean safe, that I went to sleep and knew everything would just be perfect when I woke up, and it was. I had greater balance, steadiness, was less time in the hospital. Everything that they would tell you in their talking points, probably from the robot, I think I got, then more. I have great balance and no pain. That's the big one. You know, that it was really important that, you know, people feel that they don't wait for this. That would be what I want to say. You know, according to my family physician, and he's right, I'm at an ideal age. Somewhere between 64 and 72 is that age. Don't wait. Don't wait so long. You know, you lose your muscle strength, you lose more time and bone and opportunity to get this fixed. Don't be frightened to do this. That would be what I'd say.